I thought that I'll talk about a topic which is very close to my heart. It's working an emergency evening shift on a weekend. And there are sporting injuries, there are kitchen injuries, the patients who are trying to get more creative in the kitchen. There are elderly gardeners who are amateur gardeners and they've cut themselves. And somehow there are more mental health patients on the weekends, there are more geriatric falls on the weekends in the nursing home, maybe the staffing levels are low. Last weekend, it was a Saturday evening shift, very busy. We had about 11 patients trickling in every hour. I felt the heat almost to the point of level of burn. I was talking this over with one of my friends, and he's an emergency physician working in the same hospital, and he said to me, Rizwan, any key performance index that really matters is your own well-being and blood pressure. Couldn't agree more. If we are positive, if we are well, our staff feel motivated, and overall flow is better. What I've done is I'm going to talk about planning an evening subacute, fast track, streamlined shift. And I've actually broken this talk down into three main areas: before the shift, during the shift, at the end of my shift. So let's talk about before the shift. The night before the shift. So if my shift is 2 o'clock start the following afternoon, the night before that, I would make sure that I have good sleep, at least 8 hours worth of sleep. The following morning, I'll wake up fresh. I'll go for a brisk walk or a jog. I'll take my kids with me. Or if I'm by myself, I'll listen to a podcast, a nice relaxing podcast. I'll come back home. I'll cook my lunch. Normally, I'll have a snack, 2 fruit pieces and some lean meat like chicken or fish, pack it up, and I'll brew my coffee. Now, I like to have warm shower. I think it has somewhat of a therapeutic and relaxing effect, and I'll have a power nap. I've got about 1 hour commute to work, so having fully charged myself, I feel more active and more alert during the drive time to my work. Now, as I leave for my work, I'll make sure that I'm not listening to anything distressing. If you don't like it, just turn your audio off in the car. Just nice, peace, quiet, enjoy the drive. One thing I'd like to mention is before starting your shift at home, no screen time. You will realize by cutting off your screen time in that sense, you'll actually feel more mentally energized. I tend to reach about 5 to 10 minutes early. I'll relax, unwind, then I'll go on the floor. First of all, I'll make sure all of my staff who are meant to be doing an evening shift with me are there. With my staff, both the medical staff and the nursing staff, I'll sit down and I'll go through the list of patients on the computer. We'll see what has happened since the morning. I'll take a brief handover and we'll plan the most top priority patients early on. Next, what I'll do, I'll take a junior doctor. I'll assign myself a cubicle or an assessment bay. I'll pick up the patient from the waiting area, assign the patient to my name or an intern's name, bring the patient to an assessment area. I'll take the history, examine the patient, and plan the management. Whilst I'm actually doing that, my intern is typing the notes of my assessment. I'll actually tell the patient at that very point that this is the problem, this is an expected time frame for getting the investigation or team review, and you'll be here for about 2, 3, 4, or even 5 hours. If you've ever been a patient in an emergency department, you'd know the most frustrating part of being a patient in ED is not knowing what's going to happen next. And so most of the patients are there with their carers, the parents, the friends. They can leave them, come pick them up. So that's something which I've started to do, and I think it improves overall patient satisfaction. And I'll sit the patient out back in the waiting room. I'll then pick up the next patient and repeat the same cycle again. So almost as if it's working like a conveyor belt. And by having that senior assessment early on and being directly involved the patient, I'm actually picking the patient off from the waiting list. So they're no longer waiting to have a secondary assessment. Keep track of your troops. So rest of the doctors who are working with you, make periodic reviews of their patients, if not physical, then on the computer, so they don't feel being left out. On my typical fast track shift, I would have patients who would need procedural sedation, pediatric patients who will need pediatric sedation for suturing, and go review the patient in recess who can be stepped down at that point, so that your problem is taken a priority, not just a backseat. The last thing that you want to do is you've actually not been able to prioritize them in time to have procedural sedation. It's now the end of your shift and you've got 2 procedural sedation that you have to do at about handover time. That can be dangerous for the patients and for yourself as well. As you would know, most of the delay in emergencies are either because of the investigations or mostly because of team reviews. So the patients might have been waiting for an orthopedic review, a gastroenterology review, or a gyne review, or whatever review. Make sure that you call the specialty doctors yourself. Tell them about your problem. The patients feel more engaged and valued if they know exactly what's happening. Plan your breaks preemptively. Have an alarm set on your phone. I think for me, the first break should be 3 hours into my shift. So I start my shift at 2 o'clock. At 3-hour mark, it will be 5 p.m. Take a 10-minute break. The second break, which is a dinner break, should be somewhat mid-shift at about, I think, 7:30 p.m. Have your dinner. Give yourself nice, relaxing 20 minutes. The third break of 10 minutes is the most important break. Why? Because you've still got about 3 or 4 hours left in your shift. You're now feeling mentally tired and physically exhausted too. So having 10 minutes to unwind yourself, have a drink of water, a cup of tea, meditate, close your eyes, even have a power nap. Just 10 minutes for yourself will actually make you recover in those last 3 hours in a better way. Planning the end of your shift, and this should start early on. We normally do our handover at about 11 p.m. So 1 hour before, that is about 10 p.m., sit down with your team, your intern, your resident, your registrar, your nursing in charge, and just go through the list. Make sure all of your patients have been seen, have been managed adequately. There's no outstanding plans. At the time of the handover, it does not really matter how busy the waiting room is. What matters is that you've given your level best and tried to see as many patients as thoroughly as possible whilst keeping the department safe. As the night shift arrives at 11 o'clock, sit down with your night team in charge and go through the entire list, making a plan for the patient as you go along. Some of these registrars can be very junior and they would appreciate a senior input. And if you can actually go through the patient triage information, plan the investigation and early management whilst going through the list with them, they will actually feel their load to be lightened. After I close my shift, I tend to go and take about 5 to 10 minutes and just unwind, relax, and plan my journey back home. So returning home, I would say that listen to something which is more engaging, like a crime podcast or something that will keep you in the edge of your driving seat so you don't feel tired driving back home. So make sure when you're driving back home, you're actually alert enough to drive safely. If you don't feel safe to drive, stash up in the hospital, somewhere in the staff quarters or something. The other thing is, when you reach home, I normally reach home way past midnight, something like about 1 o'clock in the morning. Have a warm glass of milk, have a shower, relax and sleep. Nothing else. How did my Saturday shift ended? As I said, it was a busy shift. We had about 11 patients coming on in every hour, but we just went and keep on seeing the patients one after the other. I had adequate break, and what do you know? At about the handover time, I had about 3 patients waiting to be seen for less than an hour. The night shift were very thankful for all the hard work all the team had done, and I think that's the way to go about it. Tell me about your ways of doing things in your particular area of an emergency, be it acute, resus, or fast track or streamline area. Let me know what works for you and what frustrates you. Stay safe and stay enthusiastic. Have a good shift. Thank you.